It sounds simple. You look at the antimicrobial report, and if it is susceptible, you can use it. Not quite. To make the best clinical decision, you must select the most specific coverage while considering cost, site of infection, and formulary restrictions. Each lab has predefined list of antibiotics they test against a specific pathogen. However, not all the antibiotics tested will be reported. This is known as selective antibiotic reporting. Selective antibiotic reporting is based on a few things, the first being the degree of susceptibility. If you have a blood sample that results as MSSA that is susceptible to a lot of narrow-spectrum antibiotics, that will test against the whole panel, but only release susceptibility to narrow-spectrum antibiotics. Selective reporting is also influenced by the site of infection. If a sample from the lungs is susceptible to daptomycin in vitro, that should not be reported because daptomycin cannot penetrate the lungs and will therefore be ineffective for treating pneumonia. Head over to pharmacology.com for other considerations for selective antibiotic reporting. Let's talk about how to choose the most appropriate option from the susceptible antibiotics listed in the report. It can take 48 to 72 hours for the CNS results to finalize. In the meantime, you can use the gram stain and PCR results to guide therapy. Microscopic assessment of gram stain bacteria helps us to identify bugs based on their shape and absorption of the stain. PCR testing detects genetic material that is specific to certain strains of bacteria. For example, the presence of gram-positive cocci in pairs and clusters indicates Staph aureus. The detection of MEK-A indicates methicillin resistance, which means you know you have MRSA even before the CNS results. Once you have your results, the goal is to choose the most narrow and specific coverage. A simple way to visualize the spectrum of antibiotic classes is to fit them into concentric circles with the narrowest option at the center. Of all the antibiotics reported as susceptible, choose the option that is closest to the center of the circles. The CNS results can also facilitate conversion from IV to PO, which saves money, reduces length of stay, and decreases the risk of infection. Head over to pharmacology.com to access the full unit, including common pitfalls to avoid when interpreting antimicrobial culture and sensitivity reports.